All right, good afternoon and welcome everyone. We will conduct this meeting via Zoom. All attendees will be muted until the public comment period. Please note that this meeting is being recorded. All visual, verbal, and written comments are public record. Panelists and fellow board members, at various points in this meeting, we will engage in group discussion. To ask questions or share a comment, please raise your hand by clicking the button on the right side of your screen. Then you will be entered into a queue when the discussions formally begin. I will call on you, or Harold will call on you in the order in which you raised your hand. After your turn, you can raise your hand again and be entered back into the queue. With that, I'll look to staff to now take roll.
I will call your names in alphabetical order by last name, and just indicate if you are present or not. Pastor Carrie Anderson.
Present.
Nate Caminos.
Present.
Paula Carvalho.
Here.
John Chelmanak. Helen Howell. Gordon McHenry Jr. Harold Odom. Looks like you're muted, Harold.
Sorry about that. I'm here.
Damian Patnod.
Present.
Adrian Quinn.
Here.
Michael Ramos.
Here.
Sarah Rankin.
Here.
And Simha Reddy.
Here.
We have 9 members present, which represents a quorum.
Thank you, Jeannie. Just take a moment for our land acknowledgement portion of our agenda. We acknowledge that all U.S. land is originally Native American land. And here in the Pacific Northwest, the coastal Salish are the original residents and protectors of this land. Some of the coastal Salish tribes are not currently recognized by the federal government, such as the Duwamish tribe, thus limiting their access to key privileges granted by federally recognized tribes. Native Americans have been present in our region for thousands of years and remain present to this day. What's not on the agenda today, fellow board members, and we do have a stacked agenda before us. However, in talking to some of you prior to today's meeting, Harold and I did want to pause here and ask that we do hold a moment of silence for 2 individuals who recently passed away. Kristen Benson, a Plymouth housing case manager at a permanent supportive housing building, was killed just before Thanksgiving by one of her clients. This has deeply affected the residents of that building and many others in the homeless services community. Also last Thursday night, a 38-year-old man was shot by men who attacked his encampment in Tacoma. Few details have been released about the shooting and his name has not yet been made public, but this horrendous act underscores that those without homes are at the greatest risk of violence. I'll ask that we now take a moment of silence to remember these individuals, starting now. Thank you. Just a couple of board updates for you all too before we get into some instructions on public comment. First off, Juanita Spotted Elk has stepped down from her position on the implementation board, and the Lived Experience Coalition is identifying a replacement for her position to be brought to the governing committee for a vote. We're certainly going to miss having a strong voice in Juanita and wish her well, and hopefully we'll have a new colleague on the board to join us in January, or at least in our next February meeting. Secondly, some of you may have seen that last week that our fellow board member, Helen Howe, was appointed to serve as the City of Seattle's Human Services Department Director by Mayor Durkin, replacing Jason Johnson, who had been serving in that capacity for about 2 years. Due to our authority's ILA, members of the board cannot also serve as staff at the city and county, so she will be stepping down, and Mayor Durkin will need to renominate someone to propose to the governing committee to replace Helen. I spoke to Helen earlier today, and she asked that I share her support to all of you, and that she very much looks forward to working with us in our new capacity. I also wanted to give a special thanks to Jason, who along with Leo was there from the beginning with all of us this summer when we launched, and for all the work he and his team has done. I understand that Jason's last day will be on January 15th, but again, wanted to express our sincere appreciation to him as well. And now I'll just go into instructions for public comment. We have 10 minutes set aside on today's agenda for public comment. If you would like to provide verbal comment, please type your name and the city from which you're calling into the chat function. Carrie and our staff will use this to build a queue for the public comment period of the agenda. In addition, you may use the chat function to provide written comments starting now into the public comment section of the agenda. Before we get into our first item of business, which is hearing from Leo and getting into the discussion about the advisory committee, well, we do have a grounding question on our agenda. And the question is, what are you thankful for this year? It's been a while since we've done this. And so I will start with answering myself and then kind of pick someone that I see on the board to go next, and we can just kind of rotate from there. We almost had a silver lining question that we didn't have a chance to get to in a previous board meeting, so I'm going to kind of also treat it there as well. As I mentioned to many of you at the start of the summer, my wife and I have been foster parents for a few years to toddlers and newborns, but we were able to bring a child of our own into this world earlier in April. And while this pandemic has been challenging to not be able to introduce my son to family members and close friends in person beyond window panes in our front porch over the last several months, I do very much appreciate and I'm thankful for spending the several hundreds of hours that I am here at home with him every day that I wouldn't have been if he was in daycare and I was running around in my day job in addition to everything else that's going on. So that's one thing that I'm thankful for very much. With that, I will look to my fellow co-chair, Harold Oldham, to share for his answer.
And that's something so nice is having a small child around. I do miss those days, except for the diapers and things. But for this year to be over with, I can't wait for this year to be over with. It seems like we've been stuck in Twilight Zone for eons. Thankful for just friends and family that have been around during this Twilight Zone of just the COVID, finding new ways of doing things, patience, and some good advice people have shared upon me in these last few months. I'll go with Mr. Anderson.
Pastor Anderson, are you there?
Yes, I'm here. Just had to take myself off of mute and say good afternoon to everybody. I'm grateful and I'm thankful for waking up this morning and being able to see the brightness of the gray skies. And so as we look to the future, 2021, I've got my bags packed and I've got my marching boots on and I'm ready to move forward and move into a new year, a new way, a new president. Hallelujah. And a new president-elect, vice president-elect that is. So I'm excited.
Thank you, Pastor Anderson. You want to pick someone out to go next?
My dear friend, Michael Ramos. Knew that was coming too.
Yeah, thank you, Pastor Anderson. Yeah, I'm not surprised. Good afternoon, everyone. Very grateful for my family, my wife and two daughters, one of whom is in Connecticut, so far away, but doing well as a teacher in high school. And I'm grateful for my staff at the Church Council that are managing to continue to serve the community while working remotely and navigating family and other responsibilities, the complexities of the pandemic and economic crises that we're facing. So grateful to my staff. I'll call on Adrian.
Thanks, Michael. Hi, everybody. I am thankful for my health and that of my family, and for family members who have had some really challenging health issues this year that they appear to be recovering, and so we are all thankful for that. And I'm also thankful, along with Reverend Anderson, for what appears to be a peaceful transition of power at the federal level. And I will call on Paula.
Hi, everyone. You know, I'm not a work from home kind of person, but I am grateful that working remotely has allowed me to come back to Hawaii. I've been home for almost 3 months now. And, you know, it's the longest amount of time I've been home since I was probably 18. So really grateful to be with my family. And I will call on Damien.
Thank you, Paula. And beyond my family, being grateful for them and their support, I would say I'm just grateful for all of the educators in the region who, since March, when schools closed down, it's almost created a new school year, and one in which many of our educators did not get a break over the summer, and they worked straight through in preparation for opening up, in many cases, a remote format. And that work has continued. And I would just say, beyond my own school district, just my conversations, is that people are tired. And so I'm hoping that, in addition to our broader community recognizing their outstanding work of all the educators and support staff, that I wish them all a restful break so that they have the opportunity to come back and walk into that new year, as many of you have mentioned, recharged in support of all of our kids throughout the region. And with that, I will call on Simha.
I can definitely work the mute button. Well, I am grateful that over this last year, in the midst of unbelievable crisis, there have been real bright spots where this community has come together to care for those who are really vulnerable. So bringing people in off the streets, for example. And yeah, I think there's been a lot of ways in which we have stepped up in this last year, and I'm hopeful that'll continue. Sarah.
Thank you, Simha. In addition to I'm so grateful and thankful for all the things everyone else has mentioned, family and health. I am also really wanting to thank folks like Simha, our healthcare workers and people who are involved in addressing the COVID crisis on the front lines. Deeply, deeply appreciate the healthcare workers and also our behavioral health workers who are among the crew that I think Simha was thanking. And I would be remiss if I didn't say how deeply grateful I am for our friends and colleagues with lived experience, whose courage and resilience, especially to be able to participate in boards like this and advocacy, is truly stunning. I'm very, very grateful for that.
Thank you, Sarah, and thank you everyone for sharing amongst us at the start of our meeting this afternoon. With that, we're already a little bit behind schedule since we just started as well, but let's pitch it to Leo to take us into an update on the advisory committee. Leo?
Thank you very much. This is Leo Florin. I work at King County's Department of Community and Human Services. This agenda item contains possible action by the board, and the board action, if you chose to proceed, would be whether or not to confirm or accept as the advisory committee to the King County Regional Homelessness Authority a slate of 18 persons that are identified in materials. So a very quick background, in creating the regional authority, we were trying to solve two big problems, persistent racial inequality and then system fragmentation. And one of the steps to solving both of those was the creation of a unified governance system. As we've described before, the implementation board is the sort of central oversight entity for the regional authority. There is a governing committee that actually accepted your nominations to become the implementation board, and that's primarily elected officials and members with lived experience, and they exercise a few explicitly named powers in the ILA. And then the ILA does provide for a third level of governance that is the advisory committee. And the advisory committee is just that. It is a body that can provide additional broad perspectives to you as the implementation board as you take up weightier consequential matters. And the reason that that was structurally important is that, as we've discussed before, the implementation board by design includes certain classes of experience, but also excludes certain classes of experience. And significantly, one of the classes of experience that is not purposefully built into the implementation board is the provider community. There are also no elected officials on the implementation board, and in fact, both of those are sort of barred categories of folks from your board. So this was an attempt through an advisory committee to provide you with formal access to a little bit more different sets of expertise. The second thing that the advisory committee is specifically trying to do is for folks who are really steeped in the system. There is local funding, but there's also federal funding that comes into our homelessness work here, and that is through something called the Continuum of Care. And the Continuum of Care is mandated by the Federal Housing and Urban Development Department, and it has a couple of specified tasks, and those include the administration or oversight of a coordinated entry for all system that assigns persons into housing, and it also includes oversight over the annual point-in-time count, and then also includes the responsibility to make decisions on allocation of federal money that comes into the system through HUD. And that's not an unsubstantial amount of funding. I believe it's about $40 million a year that comes in through the COC. The COC, Continuum of Care, has its own board, and the task that the ILA contemplates is that once that board is constructed, that they would offer themselves essentially to the implementation board, to you, for you to accept them as your advisory committee. And should that be a decision that you proceed with today, we will then have sort of integrated into one governance system with 3 levels, the local and the federal decision-making and resourcing decisions. And so that was the vision. The COC board, of which I am a member of the current iteration, but we just took a vote to seat a replacement board for ourselves, and those persons are represented on the staff packet that you received. There are 18 people on that slate. To note, if you looked, there is 1 vacancy, and so the current COC board will seek to fill that last vacancy with a local public funder, and we believe that we'll have that task done by the end of the year, this year. And so now the task before you is to take a look at that list of folks and make a decision of whether or not you would like to accept as a slate the 18 people to become your advisory committee. Other options that you have, you do have the option to not accept the advisory committee as it has been proposed from the COC. You could, under the ILA, construct your own advisory committee. You could only take some of the people on the COC board. That is also contemplated within the ILA, but the ILA is clear that the first preference would be for the implementation board for you to consider that committee as it is proposed in a slate, and then to name them as your advisory committee. So can get into more detail on any of it, but we'll stop there and answer any questions that board members may have.
Hi, Leo, and yes, please, other board members, virtually raise your hand through the Zoom system to raise, or to raise your hand to your camera too, if you could. I do have a couple questions. One's a clarifier. It was my understanding that of the slate of nominees, since we were last briefed about this, I think it was a September meeting, so it's been a little while ago. The ones that indicated geographic representation for areas outside of Seattle were not all notably connected to regional provider groups in those geographic areas. And ultimately, there was a motion to really help establish the expectation that these advisory committee members will responsibly and periodically seek input from and convey interest to the communities that they are really representing there in that capacity. My question is, beyond what was already done to establish and vote for establish this slate that's in front of us today, if we were to, as an implementation board, set to vote on them today or at a future date, would the governing committee need to vote to establish them well, or is our action today really just allowing them to get connected with these regional home human services organizations as soon as we're done here?
So there is no action necessary by the governing committee. It is solely the prerogative of the implementation board whether to accept the slate of COC board members as your advisory committee. You are correct that the COC board recently went through a decision-making process where a concern that was raised in the deliberation was whether people who are selected as representing either geographic or cultural or experiential communities are essentially sufficiently representative of or connected to those communities. The COC board did amend its charter to create an explicit expectation that at least I believe on a quarterly basis, members of the COC who have identified themselves as representative of a particular geographic, experiential, or racial, ethnic, or cultural community must go out and seek input from and feedback from those groups as they conduct their duties. And so you do not have the issue before you as a board today is not further refinement of their charter in their conduct of their roles as the COC board, but it is solely within your discretion whether to accept them as your advisory committee. And frankly, the ILA is silent on this, but you as the implementation board could provide members of your advisory committee additional guidance on expectations that you might have of them.
Thanks, Leah, for all of that. And just one last clarifying question, then I see Harold's next in the queue, and I'll turn it to him. You had spoken at the close of your opening remarks too about referring to the public funder seat. Understand applications are closed, and can you give us a little bit more background on what that public funder seat role really is in regards to all of this?
Absolutely. So the charter before its most recent amendment required that 2 members of the COC board be representative of funders of homelessness services. And so the one person who is currently on this slate is a funder, I believe it's Benjamin Miksch, and Benjamin's role specifically actually comes from United Healthcare, where they fund housing generally. The deliberation at the COC board, and just for propriety's sake, I was actually the maker of this motion. We were trying to cure concern of not disconnecting too much the COC board from the decision-making staff at the local level who are funding or co-funding COC-funded projects. So what we were hoping to create is a structural connection to either Seattle, King County, or any other municipality that would provide funding to COC projects so that the decision-making that's happening at the COC is informed by and connected to the decision-making that's happening at King County, the city of Seattle, or again, any other municipality that might begin to fund COC projects. So it was an attempt to ensure that at least one of those 2 funder seats, and this was the effect of the amendment to the charter, that at least one of those 2 seats must be filled by a local public funder of COC work.
Great, thanks, Leo. Harold?
So Leo, so what you're speaking about is when you pulled the original list from the implementation board to review. Has anyone changed on that list?
The list as you have it now is the list that the COC board voted on. I am not sure whether or how many sets of changes went through that list from the initial application until it was voted on by the COC board. There was a process where a committee of representatives from the Lived Experience Coalition, as well as 2 board members from the COC board, vetted and then proposed the slate. This list that you see before you is the exact slate that that committee proposed in its final iteration, but I do believe there were multiple iterations before that final iteration.
Okay. One more question, and I don't know, it was reported to me that by Christina herself, that she was questioned multiple times about her being authentic of where she was at and where her kids went to school. And is that something that is necessary to do personally? She felt quite attacked and quite hurt by this. She almost pulled out of the board, and she does a lot of good work in the city. I work with her on the healthcare for the homeless and multiple outreach items. It just seemed like she felt attacked by personally giving not only the application, but someone actually going over things with her, and she did not appreciate it. Could you speak to any of that?
Yeah, I can speak to part of it. So the question, and Nate asked about this as well. And in some ways, this leads to, you can trace this all back to what I would call imprecise drafting of the charter. The charter requires that people be able to represent the geography of King County. What qualifies a person as representative of a particular geography was essentially what was at issue. A couple of the complexities, for example, a person experiencing homelessness will not have a fixed address in some cases. And so to say that somebody is representative of a particular geography because of where they live actually ends up being a model that is inconsistent with our goal to have people experiencing homelessness involved in the model. And that's even before you get to the fact that other people move throughout their lifetime too. So we recognize that an address is not the right measurement. And what we were then dealing with as a board is, is it where a person works? Is it where a person grew up? Is it where a person has friends? Is it where, there are a number of different ways that a person can become accountable to and representative of a place. And so the questioning was very much around that. I think I will presume to speak for the entire COC board and apologize to Christina for making her feel attacked or improperly questioned. That is not okay, and that's not certainly what we were trying to do. And I recognize in your telling that that's what happened. So but it was this issue that I think this board is going to have to contend with routinely, which is what does it mean to represent a geography as opposed to an experience or an identity.
Point well taken, Leo. And I'm sure Christina is going to appreciate that. Like I said, she does a lot of good work in the county, but just a little bit of homelessness. In my 10 years, I've traveled throughout this county. I don't know how many places that I could say I represented. I can't say every 36 cities, but a good portion of it. So I think we should be mindful also when we're speaking about inclusion that we who are homeless sometimes have to travel a great distance through our trek of being homeless. And it might be one spot one year, another spot, whoever we can find that's going to be cordial to us, let's say, and not run us out of the town or out of an area that we are living in at the time. So I thank you for that.
All right, thank you, Harold. Any other questions? If not, discussion and open to entertaining a motion.
I have a question. I'm just sort of going through, I'm seeing the vacant position that's listed under the funders. I'm sorry if I missed this earlier in the discussion. How are we to consider that slot for purposes of today?
Thank you, Sarah. So you are correct. There is the one vacant position that would bring the board to 19. What is before your board today is the 18 people currently on the slate. So if you were to take an action today to accept an advisory committee of these 18, presumably once the COC board acts to fill its remaining vacancy and bring itself to 19 people, they would separately offer for your consideration the one additional person so that you have the entire advisory committee, but that will have to happen at a subsequent meeting.
Thank you.
Any other questions? Okay. Any other discussion, or again, open to entertaining a motion on the advisory committee that's before us today?
I move that we accept the slate of 18 individuals who are listed.
I second that motion.
Motion by Adrian and second by Simha. Any discussion? If not, okay, let's go to a vote. Jeannie will call roll.
Sorry about that. Figuring out how to unmute while screen sharing. Pastor Carrie Anderson. Pastor Anderson, are you there?
I'm here. I say yes, affirmative.
Nate Caminos
Yes.
and Paula Carvalho.
Yes.
John Chalmanek is absent. Gordon McHenry Jr. is absent. Harold Odom.
Yes.
Damian Patternod.
Aye.
Adrian Quinn.
Yes.
Michael Ramos.
Yes.
Sarah Rankin.
Yes.
And Simha Reddy.
Aye.
Okay, we have 9 ayes, no nays, and 2 absences, and the motion passes.
Thank you, Jeannie, and thank you, Leo, for bringing this update and attention to the board and for our action. Let's go ahead, and we won't want to try and catch up here with being a little still about 10 minutes behind. Let's move on to public comment. We've set aside 10 minutes to hear from members of the public. If you wish to comment and have not yet typed your name and city in the chat window to be called upon, please do so now. Each individual will be given 2 minutes to comment. Carrie will call on individuals in the order they have been provided in the chat window and unmute them. Carrie will also announce when you reached your 2 minutes and ask you to finish your comment and call on the next speaker. I will.
Okay. Ready for public comment. We've only got 1 person in queue. So we have Bill Curlin Hackett from Auburn. Give me just 1 second. Okay, Bill, your time starts now.
Thank you. Greetings to all of you. I'm not expecting an answer today on this, but we face several serious homelessness crises on the streets. And one of them is going to be at least one among many due to COVID. Right now, some of you may know that vehicle residents make up half the unsheltered count we do annually, and they receive less than 1% of the homeless dollars as support. This is really terrible arithmetic and budgeting. The second thing I want to say today is the eviction crisis portends an escalation of vehicle residents, possibly by the thousands. We know there may be other resources available in due course, but we don't know if and when they're going to come. We do scofflaw mitigation. We're doing outreach on the streets face-to-face, and we're doing remote work with those who live in vehicles. And so as you move forward, you need to keep thinking about who's going to address this crisis. Right now, it seems like we're running out of boards that make decisions, and it's in the laps of whoever is left in a jurisdiction. But as we're gathering around to deal with emergencies, crises with other outreach workers, we're all puzzled because the system itself is not as it's been. And even as it's been, hasn't been adequate enough. So however soon, I mean, you responded to a Renton crisis, probably out of character because you're not official, but someplace along the line, we need rapid responses to what's happening right now and what's getting worse and pretends to be much worse by January. Thank you.
Okay, just 1 moment. All right, we have 1 more addition to the list. We have Cindy Drushba. Give me just 1 moment and I'll go ahead and allow you to speak. All right, Cindy, if you would like to unmute yourself, your time starts now.
Okay, hello. Can you hear me?
Yes, go ahead.
I didn't really prepare for this, so I'm going to keep it brief. I think during this time of COVID, you have a perfect time for online training for everybody that's in the homeless programs. I find a lot of confusion about regulations. It seems like people are just, oh, well, I think we do it this way. This is how somebody told me to do it. And I'm seeing a lot of pain out there because they're wrong. Nobody looked at the manuals. And nobody gave the homeless the respect. And the thing I'm finding is the homeless aren't part of their process when they get placed in housing. And then they're really shocked that they can't move. I work with seniors and they're really surprised. They're happy to get a place to stay, but a year or so later, they're feeling better and they might want to move back to Burien to be near their family. And they're told, no, this is permanent supportive housing. You've been placed here. You will live here the rest of your life unless you want to leave. Seniors, at least, have a right to age in the community they want. There's not housing there at that time. We should allow them to move back. You know, if it's a 40-year-old and they don't like where they live, they can get a job and move on and pay their own rent. But we're placing seniors, which is, I think, our highest rate of homeless people. They grab it. There's only one spot that day, and they're sick of walking the streets of Seattle. So they take it. A year or so later, they're a little bit more balanced. They're thinking correctly. They want to move back to the community where they want to spend their life in this area. And they're told, no, you were put here. You will remain here or you will have to leave and be homeless. That's awful. So those are and they didn't know that. They might have said, I'll choose to be homeless until that area opens up. But they're not told anything. And I think it's really sad that they're shocked and we treat them like, almost like Britain, where we just put you in the poorhouse and don't complain about it. And I think it's awful. Seniors have a right to move where they want to age gracefully.
Thank you, Cindy. Your time is up.
Okay, done. Thank you.
Thank you. All right. I don't see anybody else signed up for public comment, but I will leave the chat open for the next 10 minutes if anyone wishes to write a public comment in.
Thank you, Carrie, and thank you, Bill and Cindy, for sharing your comments with us today. Okay, let's get going on to the next portion of our agenda, which was discussion on our executive committee. So Harold and I have already proudly served as your co-chairs for a month now. It feels maybe a little longer than a month, given all the work that we've done since we last had our regular meeting, but it's been really great. But one thing that we did last leave off was, again, somewhat of an ongoing discussion of if there's anything else that we'd like to, any other additional roles in the formation of an executive committee beyond the two co-chairs and Harold and I that we may want to explore. We've talked about, and of course staff has given us great models and recommendations too in recent weeks about a vice chair model. Also, if we wanted to even be a little bit more specific to that, in creating a treasurer and or secretary in that discussion. So very open in terms of the ideas, but wanted to bring this back on for everyone's awareness and to see if folks had any thoughts to share or proposals to make. And we can or do not have to take action on this today too, but at least wanted to bring this back on discussion. So anyone have any thoughts?
I'd like to ask the co-chairs if they have, especially cutting your teeth over the course of the last month, if you have any specific ideas that you think would be helpful, since you're sort of carving the path here in terms of leadership. If you think there's, if the two of you have talked about a structure that would be helpful and supportive, especially of the work of our board, but also supportive of the leadership of the two of you.
Yeah, I'll speak first and then pitch it to Harold to give his perspective too. While Harold and I probably talk every other day in some given form, we have not specifically talked through a structure that we might want to propose to the board in that regard. I think even in the short 4 weeks or so that, and being in the co-chair role and what all the work that we have ahead of us particularly in January and February, but more so in terms of what we expect of ourselves and others in being conduits to the broader community, in terms of talking about the implementation board and authority as we get a little bit more of our legs and structure under us, in addition to the onboarding of the CEO. I could foresee that workload beyond just what we've been doing so far expanding. In terms of what roles and what's really necessary when, I don't have a solid answer on that yet. I will say just a special shout out to staff all in this room and not participating or dialed in right now that have been very supportive and helpful to Harold and I in a lot of these different ways, as well as each of you. As a special meeting last week is just a prime example. But no, to answer your question more pointedly, don't have a specific structure recommendation. Harold?
So, thank you, Nate. So, if I remember correctly, and I believe it was Ms. Howe, the structure was to get co-chairs in place and then formulate an executive committee. How that's to be, it's up to all of us. I've heard from several of you that whenever we do a structure, that you want to be heard. So this is that meeting to bring you all in and let's do it constructively and think long term. We definitely need a chair or a treasurer and a secretary. If we need a vice chair, I'm not sure. I don't know about you, Nate, but I think we're doing well back and forth of each other. And but I would be interested in looking for a treasurer who people have voiced that it should be someone who has had that position before and is deeply versed in the process of being a treasurer that could help us all understand the financial part of this board.
I have a question. When it comes to a secretary, like I understand it for some boards, but this board is staffed through the county, and so I'm just wondering what would be the difference between continually being staffed and having people on board to take notes and send out doodle polls versus having a secretary on board. And then also when it comes to a treasurer and like finances, I know that, we would help set the budget with the CEO or help like approve it and stuff, but does this board actually have a pot of money that we need a treasurer to oversee? I guess I'm just wondering a little bit about that.
And I'd just take a second to pause there and for staff to recognize that our fellow board member, Gordon McHenry Jr. was able to join us as well. But thank you for your question there, Paula. Anyone have any thoughts or points to Paula's question there?
I think we do have a pot of money and we can request more monies. Staff has given us a memo earlier, a few months ago, where we set aside a pot of money for the CEO to hire staff. And so we do oversee that. And I think as it goes further on, we will be overseeing a great deal of money and having our opinions on how that money is spent and to which way where it's directed throughout the homeless community and the services and the service providers. I think we will weigh heavily on that as far as it goes with the theory of change and how equitable providers are being, and if we're hearing complaints to the ombudsperson. So I think treasurer is very important just to keep us up to date on, let's say, best practices.
I do recall a few months ago that we spoke about this, and I'll look to you, Sola, right after I share this as well. Thank you. That fellow board members a few months ago expressed someone who would fill that treasurer role, someone have a lot of experience in that capacity, given what we were presented from staff back in late summer, early September of the work that Harold just referenced that we have it before us. But Sola, go ahead.
I think I just want to add a couple of clarifications. I think at this point, Jeannie and I are assigned to provide support necessary to this board in terms of meeting minutes and notification and other kind of key tasks related to the support of the implementation board. I think you all can decide if that's something you want us to continue to do in the future, or if that's something that if that is a role that you want to adopt as the implementation board. I think in terms of Treasury, right now the authority has no money and won't have money until funds are allocated from city and county to the authority, and the CEO will have oversight over business decisions related to spending, etc. And you all will have the opportunity to approve those expenditures. So I'm not sure that a treasurer is necessary either from an executive committee function. One thing you may consider in addition to the vice chair option is, how do you want to identify leads for subcommittee work? If there are subcommittee work that needs to happen in terms of, say, for example, regional planning, how does this board want to engage in that and provide leadership to subject matter experts that you might want to convene, something like that? I think that's where you might want to be thinking, but I don't know that treasurer is necessary right now.
Thank you. So, Leo, did you have anything else to add in regards to the treasurer role and financial scope to the board?
Happy just to provide a little bit of detail around what SOLA was providing in that. Currently, the Regional Homelessness Authority is not in control of any funding directly, with the exception of that relatively small amount that we did, that the implementation board took an action to authorize earlier this year. Over the course of next year, we do expect that the regional authority will begin to assume control of contracts and the budgets associated with those. The total amount, when it's all said and done, we believe will be north of $100 million per year in overall budget. That will be contracted to the regional authority by 3 sources. So initially it'll be just the King County and the city of Seattle. In addition to that, eventually the COC board we presume will begin to directly provide money to KCRHA instead of it currently coming through the city of Seattle and King County. And so there is a substantial amount of funding that will come under implementation board oversight over the course of what I expect to be the next 14 months. And again, that total amount will eventually be in excess of $100 million per year in budget.
Thank you, Leo. Just doing a time check, I do want to make sure that we at least dedicate some time of the 40 minutes we have left to 2 other major items on our agenda. What I could propose now is that, Harold and I could meet with staff and take some of the discussion and ideas shared from the board and come back to you in January. If there are any other ideas or thoughts from you now, if you could please share them so that we can move on to the next agenda item. Or afterwards, obviously, for the handful of individuals who are unable to make today's meeting, Harold and I will be sure to follow up with them then too on this next step. Okay, not even going to do a motion, just going to do that as a task. Just know that Harold and I will have a co-chairs meeting with staff next Monday, and this will be a part of our agenda item with staff. You'll be getting an update next week, and we will connect with other board members thereafter as well, and you'll hear from us more in our January meeting. With that, I will look to Harold and Sola in terms of the theory of change portion of the discussion for today's agenda.
Thank you, Nate. Thank you very much. Sola, were you going to provide background or?
I was just going to project your presentation if necessary, but I think you have it.
I'm gonna start off with a little clip if I'm able to, and let's see if it works. So I'm gonna try to share my screen. Let's see. Host to see. Oh, so do I have to send it to you, or could I share my screen, or no? Sola?
You are muted, Sola.
Sorry, let's make you a host.
Okay.
Carrie, can you make Harold a host so that he can share his screen?
Yep, just went ahead and did that. Harold,
Thank
did
you.
you see that option now?
Yeah.
Okay, great.
So I love this video. I've done some work around it, but it basically lays out some good grounding spots that we can go from on question and answers, our discussion. So this is a 2.5-minute video.
Homelessness is an issue that far too many people face. People of color, specifically Black people and other persons of color living in homelessness, experience homelessness.
Harold, it's really difficult to hear. Actually, if you pause it, I'll walk you through a way that you can help it be heard. So if you click on share screen again,
Okay.
and then I
You
think
sure?
I think it should say, so stop sharing.
I just see the share option.
Okay, so click on share screen, and then there should be a middle tab that says advanced. And I think
Yes.
there should be an option to share the sound for you.
Oh, I see it. I see it down here.
Okay.
Okay. I do see it.
Okay, let's see if that one helps with the audio. Otherwise, you can send it to me and I can also.
Okay.
Gender identity, and
better?
more experience
Much
compounded
better.
barriers
Thank you.
that
Okay,
further
great.
homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the U.S. general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system, to housing, to healthcare, to child welfare, to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it, so we can do more about it together. To learn more, visit safehousingpartnerships.org.
And I'm going to leave it here. Just 3 people. Can you tell me something that you notice about this Thanksgiving dinner that's kind of skewed? I'll just call on people. Damien?
You said something that's skewed?
Yeah, a few things that are skewed.
Well, you have everybody kind of facing towards the Black child in the photo.
Franklin.
One of the things, how they're viewing that individual.
Sarah?
Franklin is sitting by himself.
And Paula.
I would say food distribution isn't even across the table.
Cool. Thank you all very much. So, the 1968, Schultz put out this cartoon for the Peanuts cartoon strip. Franklin is by himself on the table. He's also in a lawn chair, and he's looking at everybody else. Why am I over here? The dog has a seat. Why don't I have a seat? When we bring someone to the table, we must be questioning our intention. Are we just bringing them to the table to bring them to the table? Sitting on there on the side by themselves without any really plans to listen to them. So I ask that the theory of change be put on the top of our agendas. So if we're going to build a homeless regional authority, we should include those people who we're serving first and center them. Center Franklin on that table. What are his needs? If we fill his needs, we might fill his housing needs as well. Get people not ready for housing, but get them into housing, where we'll see, and it's been evidence-based, that they'll get more healthier. They'll start getting these services that are provided, because it has to be wraparound services. It has to be services that we can give people, and not in a policy way, but in a roots ground on the street level. I wish we had the time, and it wasn't COVID, where we could walk and go on field trips just to meet people and outreach. It would benefit us greatly, I believe, because we're doing things by proxy now. Theory of change is that we get grounded into it. Understand at every turn, there is someone who may not speak nicely, who may not be all happy just to be at that table, because you know what? They'll be pissed off that finally you're bringing them to the table and they have a lot to say. We've been looking over them, but speaking for them and speaking to them and telling them how to be homeless. Homeless is a job that I think it'd be in six-figure salary if it was based on how much work it was, how much things you had to do. Bill Hackett explained something very true. We're not addressing certain issues because we're not bringing people to the table. Bill's not being brought to the table. He's coming there to tell us what we need to hear. But at every turn, we should have someone or a group of people who are homeless, and we listen to them. What are their needs? What do they think would work for them? Why are they not going to shelter? I have a list of about 412 people I've spoken to over the last 6 months, and 37% say that shelters do not treat them well. They don't have a theory of change. They do not go to the homeless population that they're serving and ask them how they can serve them better. Women who are on the street go on the street because of domestic violence. Domestic violence and sexual assault is the #1 reason women are on the street. We don't have enough supportive housing for them. Our shelter where they can bring their children if they're over a certain age. Think of the trauma we're re-causing people because we're not doing the theory of change. Now, I'm not saying we as a collective or individuals are to blame. I myself, I lived in Beaverton, Oregon, and things vomited out of my mouth that just I cringe at, that I could have said. Not in my neighborhood. My kids, you know what? I'm in a nice neighborhood, have a corner house. My kids can walk to the library. Get those people off that railroad track across the street from me and do it as soon as you can. I can't believe I was so hateful, because that's what it is. I'm not going over there saying, what would it get, to get you into housing or get you back on your feet again? Maybe I could help. If we have that attitude, maybe I can help, instead of listening to, and I'm sorry, I'm going to hurt some feelings here and step on some toes. Policy is not the way to go all the time. I was giving some talks at the University of Washington before COVID, and the School of Policy, And I ask this question all the time, well, can I see a show of hands on how many people have done any volunteer work at any shelter or have gone out and done any work as far as getting into the homeless community? And usually it's 1 or 2 people. And those 1 or 2 people who invited me there because they worked at the city or county and we run into each other. I think maybe policy should be a year of understanding what homelessness is, or those services that are ingrained into the homeless population that really need to be broken away from. And I talk about this story that if you understood what housing was in shelter, like people feeling safe, not listened to, gay and lesbian and transgender people being outed and being told they're not welcome. I don't know what gives us the right to say to someone when the city and county and the taxpayers are providing this money that you don't have a right or you should be felt unwelcome in this shelter. So the theory of change is if we're going to build this, all these things that are intersectional come to light. They come to light because we bring them to light. We might say things that are wrong, say them, because you know what, generally we can bring it back to ourselves and talk about it, how we can change our thought process. And maybe I'm not seeing things right. It's up to you, all of you, to help mold us, because we are doing something different. We have 36 cities that we have to bring together and cohesively. And the part 2 of this is an equity piece, how we're going to do it equitably. And when we're centering people, you don't say that's hard. Take on the attitude, no, we have to do these things now. Because if we get put it on the back burner, it'll always be on the back burner. Something we have to go back to, a parking lot. So I ask of you in this theory of change talk that I'm doing is to be mindful that we put it in front of us at every single stage. We have the CEO, whoever they are, at every single stage. Because if we just do the things that we've done in the past, we already know the outcome. So let's try something different, centering people equitably. And I'm here at Tiny House Villas in Georgetown. And one of the things that just irks me is that instead of outreach bringing people in, we let people come in, split up, and go into their own houses. Well, we already know the equitable numbers. It just makes it grow more and more and more. Less likely, if you're of color, you're going to get into a tiny house. And it's not only this one, it's everyone, because there's not a policy that says we're centering people on the street first. You know, and I think that should be our central point of the theory of change. Ingrain ourselves into it and see how it works.
Thank you, Harold. Yeah, let's take a pause here just for a second. You know, I know, Harold, you and others on this board have referenced the theory of change in our recent meetings since we launched earlier this summer. And 20 minutes obviously isn't just enough for us on a calendar today to really get into it in the way that you started to kind of lay this out a little bit more in terms of the what it is and what it means for all of us and how we might apply it moving forward as an authority. So thank you for bringing this to us on the agenda. I did want to allow some time. I know this is of importance to other members of the board that wanted to bring this to discussion as well, but just note, just in terms of what it might be in relation to our agenda, what this might mean for us and implementing it in the future. I understand that the document that was shared for all of us in our board packet today was run from 2018. And it was all Home Coordinating Board adopted this theory of change, and the Lived Experience Coalition really lives by it in the way that Harold's brought us to this discussion this afternoon. I understand, and it'll be part of our next discussion for development of the work plan, that part of our ILA states that the theory of change, or a version of that for the authority, be a part of the 5-year plan that we'll be discussing in terms of our outreach and engagement with our customers, stakeholders, and again, a part of our regional action plan. But wanted to lay that additional foundation for what actions we may need to be taking here in the coming months. But before, I obviously don't want to just have Harold and I just talked to you about the area of change. We want to be able to have a chance for other board members to weigh in here too before we move on to our next agenda item.
I know there's questions out there.
Harold.
Adrian?
Yes.
Harold, thank you for a great presentation. I guess a question that I have is a process one. You know, I know that you represent the Lived Experience Coalition. I believe Sarah does as well. Is there more that we should be doing with every decision to check in to make sure that people who are experiencing homelessness believe that that is the right decision? And so how do we do a better job as a committee sitting here on Zoom, centering people who are experiencing homelessness in any decision we make?
I think I'm not on mute. So Adrian, I know all of us are out in public. We see people, and we probably know people who are close to us or friends of friends who are close, and that we can ask, sit down and have that conversation. Bring people into this board and introduce them. Next presentation will be the equity line, how we can do an equity-based decision-making platform. But that's something that's going to take a little bit longer, and I really don't want to go into that right now. But you asked the right question. How do we bring people in? We just do it. The process is hard. The theory is very easy, but to actually do it, to bring someone in, we have to be intentional about it. This is my daily work. I go out and I meet people, I see them, and, you know, I mask up, I tell them, give me my 6 feet, you know, and I work with the Seattle pet clinic as well, where I meet a lot of people through the pets. And my dog just picks them up, so give me 1 second. It's just something we have to do. And I know all of you, and I might be assuming, have other roles in other boards that you can bring some discussions from those boards. But the most like to see would help you in your homeless endeavor. And you're not going to get the same answer from everybody. When I'm doing the shelter thing, Todd, I get cussed out because people know that I know what's wrong. Why do they have to tell me? They have to understand that their voice is very valuable. So I hope that answers your question.
Thank you, Adrian. And Harold, I just do want to also recognize that our fellow board member, John Shamanek, was able to join recently as well, just noted for staff for attendance purposes. Welcome, John. All right, let's move on. Thank you so much, Harold, for bringing this to attention, everyone. And again, obviously, we're going to have a dedicate more time for future meetings to have a deeper discussion about the area of change. But again, thank you so much, Harold. Let's go on we'll go on to the next item of the agenda, which is our initial work plan, which, you know, again, partly applies to the theory of change discussion that we just had. While the interlocal agreement for the King County Regional Homelessness Authority, if you want to look at the ILA, if you don't already have it in there up on screen like I do, page 7 requires the following: that we develop within 6 months of the first implementation board meeting an initial work plan that describes an organizational structure, a plan for initial implementation of contracted homelessness services on behalf of the county in Seattle under the terms of the respective master agreements, and a description of goals and activities that the authority will undertake until approval of its first 5-year plan. Such work plan will be recommended by the implementation board and approved by the governing committee. Note that the 5-year plan is due 18 months after operations of the Regional Homelessness Authority begins. And this plan will detail work to be done up until the 5-year plan is in place. We had our first meeting in mid-August. So this plan will be due in February, likely before our CEO is in place. Staff brought this to Harold's and I attention a couple weeks ago, and today we'd just like to get your early thoughts on what you have that should be in a part of this plan. And also look to staff if there's anything else to add that I failed to mention or cover in setting the tone for this discussion.
Nate?
Yeah, Gordon?
Hi, it's Gordon. Since we don't have a CEO, if we're working on elements of this plan, is the opportunity for us to set expectations that become part of the CEO's statement of work. And what we're doing is getting that off to a start. And then, in other words, the work that we're talking about is not work that is necessarily first and foremost for us to accomplish, but it's for the entity to accomplish. I just want to get a little context on that.
That's my understanding, Sola.
Yeah, I would confirm that that's the case. And I think one of the things that we're just wanting to ante up is to consider what direction we want to provide to the CEO once they get started. From the board's perspective, I think there's going to be some key expectation that's outlined in the contracts that'll be provided to the CEO from the city and the county. But in addition to that, how are we really living into the expectations of the ILA in terms of kind of broad operational oversight, and how are we making sure to fulfill the vision of the ILA and help to shape the kind of, I don't know, cultural attitude, I guess, of the regional authority and how we work in partnership with the CEO.
Yeah, Gordon, I'll go just another 30 seconds because I'm still forming my thoughts. It's not a specific objective, but it's an area of concern, which I think is reflective in the special meeting we had last week, which is how do we help the CEO, help the authority meet the expectations around being effective regionally when we have 39, 40 municipalities, each with their own authority to put in place policies, rules, and administrative aspects governing services and support for those who are struggling with homelessness. So it's something that I want to be thinking about is how do we keep that first and foremost in terms of not just building a relationship with the 39 municipalities, all the entities, but coming up with an operative vision that's rooted in the theory of change that those entities hopefully can understand and buy into and support and operationalize. Mm-hmm. I'll stop there.
I think about that. I think about, and tell me if you all want me to pause as the staff person, but just thinking about the variety of work that has to be conducted over the next year that is really ending up kind of being in the weeds. What do you all want to know more about and be better informed or best informed on in terms of regional planning activities? Do you want to provide direction to the CEO on how they begin to do that? When do you want them to report back to you on progress? Thinking through budgetary requests, that may not be something that you all need to entertain in 2021, but it may be something that you have to entertain in 2021, considering implications of the pandemic and things like that. I think there just could be a variety of areas to weigh in. I think about RFP development in terms of redesigning contracts and how the system is being responsive to the vision of the regional authority. You'll have to, the regional authority will have to release an RFP to refund programs. And so how does this group get involved in that, and what direction do you provide? Just some food for thought.
Thank you, Sola. Yeah, Adrian?
So I'm thinking that the new director is going to be facing a crisis as soon as they walk in the door. We will be facing evictions. We still will be experiencing poor economics, and so we may be continuing to see a surge in people who are becoming homeless. And so I think that the way that we could be most helpful is by trying to make sure that the new director has the tools that they need to lead through a crisis, while at the same time do the things that Sola is mentioning. The work will, the RFPs will still need to happen. They may need to happen on a very fast time frame to adapt to whatever crisis is that we are experiencing that is even greater than the homelessness crisis they're experiencing right now. So that's just my thought.
Thank you, Adrian. Simha?
Yeah, I appreciate Adrian's comments. I think that when that CEO walks in, they're going to have a lot to do, and they're going to have to be caught up to speed very quickly. And I think one of the biggest roles that, I think the biggest things that we need to be doing, either as the implementation board, is to really come up with a strong transition plan, right? Like the creation of RFPs, that doesn't need to start from scratch. I mean, there's a lot of knowledge that already exists within King County, within Seattle, within our outlying cities. And trying to put those together, trying to put together the group of people who will be the help with that transition from other agencies to this new agency, but also just the set of tasks that will be required and the resources that they'll need to accomplish them, right? Because it's not even clear in my mind, like what that full list of tasks are just to keep things running. So yeah, I'm not sure how we go about making that happen, but if there is some way that we can help, I think we should.
Thank you, Sarah.
Is there a place, I struggle with this all the time, is there a place, a consolidated location for up-to-date information about what the city and county are doing on homelessness, some live dashboards or other, because I know there's bits and pieces of information all over the place. I'm thinking it would be helpful for everyone, people within the King County area, for service providers, for this board, and certainly for the new executive director, to have a database of information all in one spot instead of all over the place. So I'm sort of wondering, is there any effort like that underway, or Sola, maybe you and others have a good perspective on this. Like I said, I'm aware that there's sort of consolidations of information in various places, but is there any effort to mainstream that, especially in light of what we're trying to do here as a regional entity?
So Leo just put in the chat the regionalhomelessness.org link. Where what's happened is we've consolidated everything into that website that the county has been managing, that All Home had access to, and is where all documents related to the implementation board activities, governing committee activities, news items, CEO updates, all of that is on the regionalhomelessness.org link. And there's a whole lot more kind of depth of detail that is like the next level down from the macro timeline that you all have had an opportunity to look at. And so I think we need to talk a little bit about like how much detail this group might want, and then how much we want to make available, like if anything is to be added to the regional homelessness site, what does that look like and how valuable would that be?
So just to clarify, because I mean, I'm aware of the information that's there, but would it have the capacity to become a more ambitious sort of place for for information. So some examples that come to mind to me immediately is some of the stuff that some California cities are doing, where they have live dashboards of how many people are waiting for shelter services at any particular time, where they have information about how many shelter beds are available, how much affordable housing exists, those sorts of easy to understand bits of information that I think would be helpful for everybody to be on the same page about. That's one type of information. And then there's, sort of stuff that's specific to what we're doing here regionally, but also individual cities, have their own information. So I guess I'm just sort of thinking out loud. If I were, an executive director, I would want coordinated information from all of the different entities that are participating, and I'd want to be able to make as much of that as transparent as possible to people beyond the board. And so I guess I'm just sort of asking the question, as we're thinking about what might be helpful for the executive director, is that particular website a place where we could put that sort of information, or is there any vision that we might be playing in that sort of role to help facilitate the collection and accessibility of data to a larger audience?
I think I would say yes, that is certainly a place where we could do that, and establishing what the plan is for that is something that would be a really critical item to add to the implementation board's work plan, to explore that in the future and to direct the authority to evaluate what it would take and to come back with some kind of a plan potentially, and maybe that's a request that gets made, and then I would see if Leo has anything that he wants to add from the kind of oversight of the homeless management information system work that you all are managing at the county.
Thank you, Sola, and if I may, from the chairs, that link that I sent out has some things that you are talking about, and it does not have other things that you're talking about, as you pointed out. So what it does get into when you get into the links around data is there is really extensive surfacing of the data that's generated by the homeless management information system. That is really retrospective, although the recency of the data has improved quite a bit recently, but it is backward looking. And so you can get a sense of what types of interventions are working and how many people are enrolled in those types of interventions. What it does not capture is the inability to meet a particular, or what's the delta between what we're serving and what the need is. And I think going forward, as this board will consider from the CEO a 180-day work plan, then eventually a 5-year work plan, that this board absolutely will have the ability to advise or prescribe of the regional authority that online data systems come up online, and you'll have the ability to match resources to do that, that quantify the performance measures that you lay out in your 5-year plan. And so right now, I would not want to overstate the ability of the current system to drastically change the online data, although we keep working on that. But I think as in my role as staff and overseeing one of the departments that's doing this, I also wouldn't want to overstate our immediate flexibility, as we are frankly spending more time preparing to hand systems over to the regional authority as opposed to changing them fundamentally right now.
Thank you, Leo, Paul, and Sola. Now I'll go to John. We have just 3 minutes here, so we'll get to John's question or comment.
Yeah, just coming off of mute and going on. Now I'm trying to figure, oh, there I go, lower hand. So to put this plan together, it sort of strikes me, and I'm hearing a lot of very good things that I would agree with on here, but I almost think you want to have what is a reasonable outcome? What are the outcomes that we expect about the street? Okay, so what about, so will we see over the next 18 months, whatever time frame that is, expansion of what I would call hard emergency shelter? Do we want to go to definition and defining the services that need to be provided, which would be part of that transition into the RFP process that Simha was talking about? So if we're going to be defining the specific services that shelter providers need to provide for emergency shelter, I think that defining those out is really important. The data, as Sarah says, is really important. And one area that I think that is also a key here is the connection between this group and, I think they're still really out there, it may be under a different name, but the funders group, that is the private funders group. So how will that group integrate with the start of a plan and then a 5-year plan? And just in terms of dashboards, my understanding is one of the players in that now is Tableau, and that's what they do is, they help you crunch the numbers and they come up with the dashboards and the metrics. So those are just my thoughts on it. I apologize for missing the meeting the other day and missing the first hour of this meeting.
Thank you, John. Appreciate that. We are getting really close to close now. So any other final thoughts on this topic before we just open it up for any other action items or announcements before we adjourn? Okay, thank you. And the 20 minutes we had to think about what our 5-year work plan was going to be, we had a pretty substantive 20-minute discussion. So appreciate all your thoughts and comments. And if you have obviously additional ones, please don't hesitate to share with Harold, myself, and staff as we prepare to bring this up again in future meetings. And with that, now I'll just open it up if there's any other action items or announcements. Otherwise, we will close to adjourn. Seeing none, thank you so much for all of your time today, this afternoon, and I hope you have the rest of your wonderful day and week ahead. Be sure to hear more from Carol and I here in the coming week. Thanks so much, everyone. Have a great day.